Come in.
Hi, how are you?
I'm feeling good. How are you?
Pretty good. My name is Erica and I'm going to do your assessment today, okay?
That's fine, yeah.
Can you tell me your name and date of birth?
Sure, it's Lisa Mulhausen, 11/21/1970.
And where are we at right now?
We are at PM Health in Georgetown, Delaware,
Okay, and what year is it?
2023.
Okay, so my patient is alert and oriented, her affect is appropriate for the situation, and she looks well coordinated. So for your assessment today, we're going to assess your hair, skin, and nails, as
Okay.
well as your eyes, ears, nose, and throat.
Okay.
If anything is uncomfortable, you can just let me know and we can stop.
Okay.
Okay, so I'm going to start by inspecting your hair.
Okay. We can take the headband off if you need to.
Okay.
Yeah.
Sorry.
There you go. No, it's okay.
Okay. So her hair is evenly distributed. Her head is normocephalic. I don't see any masses, lesions. That looks good. I'm gonna look at the skin on your arms. And I don't see any issues with hair loss. Everything looks normally distributed. No lesions, bruises, bumps. Her skin color is normal for her ethnicity. Look at your legs. I don't see any issues with the skin color or hair down here. I would look at her toenails, but she doesn't want me to take her shoes off. I'll look at your fingernails up here. I don't see any clubbing or curling. Her nails are not brittle, they're appropriate color. Her skin all over is appropriate. No cyanosis, jaundice, or anything like that. No skin rashes, all that as well. I would also look at her skin and hair on the chest or the back, but we're not gonna take our shirt off for the video. I'm gonna feel your throat. I don't see or feel any tracheal deviation. There's no goiter. Can you swallow? Is there any pain when you swallow?
No.
Any sore throat?
No.
Okay. Any drainage from your eyes?
No.
No pain, no sensitivity to light?
No.
Any nasal congestion?
No.
And no drip, bleeding from there?
No.
No discharge from the ears, no ear pain?
No.
Okay. I'm gonna palpate your lymph nodes. We're gonna do pre and post auricular, submandibular, submental, parotid, posterior and anterior cervical, and supraclavicular. Any tenderness?
No.
And I don't feel any inflammation or swelling. They are not easily detectable. I'm gonna palpate the temporal arteries. Could you take your glasses off for me,
I
please?
sure can.
And I'm gonna listen with the bell of my stethoscope. I don't hear any bruit there. No bruit there. I'm gonna check your sinuses. No tenderness with that?
No.
Okay, and TMJ. Can you open your mouth and close it? I don't feel any crepitus. Is there any pain when you do that?
No.
Okay. I'll start with checking your eyes first, so I'm gonna turn off the light. Maybe. With the ophthalmoscope, we want to turn the light on and make sure that this dial is set on 0. I'm going to use my right eye to check your right eye and my left eye to check your left eye. And we're looking for the red reflex here. And I see that. And And that's good. And we can also see the corneal light reflex with that as well. Checking the cardinal gaze. We'll go. Okay. And that is also checking cranial nerve 3, 4, and 6. Now we're going to check cranial nerve 9, 10, 11, and 12. 9 and 10 is the gag and the swallow reflex, glossopharyngeal and the vagus nerve. So I would use a tongue depressor and say ah, ah. And we have a gag reflex that is present. And then can you take a drink for me?
Sure can. Just a sip or a drink?
Just a sip is fine. And there's no coughing, no difficulty swallowing.
No, it went right down.
Right
no
there.
problem.
So no signs of dysphagia. The accessory nerve, and you're gonna lift your shoulders up against my hands. Good. And then can you turn your face against my hand? Good. And how about this side? Good. And then the hypoglossal, it's just, can you stick your tongue out for me? And move it side to side. Good. Her movements are equal bilaterally with no pain. I'm going to use this light here to peek in your mouth, okay?
Mm-hmm.
Just relax your tongue and say ah.
Ah.
The palate is intact. Her mucous membranes are pink and moist. I don't see any issues with dental hygiene. And her uvula rises with the ah. That's good. And while I'm here, I'm just going to look in your nose. The nostrils are patent bilaterally, and the nasal turb notes and the septum are intact. No bleeding, no drainage, everything looks well there. And for your ears, I'm going to hold this otoscope like a pen and use my left hand to pull up on the helix, and we don't have to put the speculum deep in the ear, just enough to see the light reflect off of the tympanic membrane. And same thing on this side. Good. Do you have any questions, comments, concerns?
No.
Everything's well?
Yeah.
All right, well, thank you very much.
Thank you.